Hello everybody, this is Dr. Mike Berardis. Most of my patients call me Dr. Mike. And today I want to talk a little bit about the COVID-19 masks. And so I want to talk about, there's 2 or 3 different primary types that I want to discuss today, and I want to discuss the difference between the two. I think there's a lot of confusion out there as to which is the best mask to use, and quite frankly there's a couple of options. So, and for reference, I want to make sure that everyone knows where I'm getting my research from. It's from the British Medical Journal. It's a very prestigious medical journal, and they're the ones that have this information regarding masks and their effectiveness. So let's start number 1 with the most common mask, a cloth mask that's blue on one side and white on the other. As a matter of fact, the proper way to wear it is with the blue side on the outside. And so this basic simple mask goes around your ears. It's pretty comfortable, it's pretty form-fitting, but it only gives about 20% of a effectiveness in terms of particles reaching your respiratory system. So, and COVID-19 is a respiratory illness, so it's only about 20% effective in keeping particles out. So that's the primary simple mask that has blue on one side and white on the other. And next mask I want to talk about is what they call an N95 mask. This is actually called a K95, probably a knockoff. You know, they're hard to get right now, masks, so everybody's scrambling to produce their own version. But this is a K95 or an N95, and the N95 mask keeps up to 95% of the particles out, and that's probably why they call it the N95. And so it's a better mask. It's not as comfortable. It's not as form-fitting. And so sometimes when you wear a mask like this and you see that there's space on the sides, you have to realize that those masks are actually letting particles in. So not always as effective as we think. The third type of mask that a lot of people are wearing now are what we call the homemade or cloth masks, maybe made with a bandana or with some, you know, kind of cool cloth that you found, and people are making homemade masks, and that's really cool as a fashion statement. They're not very effective, however. As a matter of fact, those masks are, like these masks, are supposed to be disposable. This one especially, you know, worn once and disposed of. And so those masks, those homemade masks, those cloth masks, people are wearing those multiple times a week, multiple times, and they're not, you know, that cleanly. They keep moisture in, and moisture is a problem as well. Just so you guys know, the particle size, in other words, what these masks keep out, is 0.3 micrometers particle size. The COVID-19 particle size is 0.1 to 0.2 micrometers in size. So again, you know, these are masks that a lot of people are wearing. However, they're not really effective at keeping out the very small particle size of COVID-19. The homemade masks, like I said, they're not great, but if you do wear one, make sure you wash it regularly, like you'd wash a t-shirt or a pair of underwear. You know, you wouldn't put a pair of underwear on twice, I hope, or a t-shirt on more than once or twice. Twice probably not being an option for most people. So make sure with the homemade masks, you wash them regularly. Don't give your grandma or someone who's immune deficient or immune compromised a homemade mask thinking you're going to do something nice for your grandmother, because they really don't work. Better off with one of these 2 options here. I think most surgeons like these because they're comfortable, and they only keep out 20%, but some is better than none. You want to make sure though that when you wear a mask that you don't think that it's licensed for being more reckless or less you know, inclined to have less exposure. You don't want to take risks you wouldn't have to normally. Most of the risks, though, really are for the comorbid patients. Comorbidities mean the things that decrease or depress the immune system. And they have found that diabetes and obesity and blood pressure, high blood pressure, are 3 of the comorbidities that are at highest risk for developing an infection. And remember, you know, I mean, you have to remember, we are born with an immune system that's supposed to be there on board to keep us healthy and keep us robust. So What kind of things are you doing for your immune system? Are you getting enough sleep? Are you taking your vitamins? Are you getting a good nutritious diet? Are you limiting your sugar, your alcohol, and your caffeine, and those kind of things that might help to suppress? Are you limiting the drugs you take? These are things that suppress the immune system and don't give your immune system an opportunity to fight your battles. Those are very important things. As a matter of fact, 1 in 4 colds, they say, is a corona-type virus. 1 in 4 of the colds that children get is a corona-type virus. And most children are not dying from this condition or this disease because their immune systems handle it appropriately. So remember, God gave you an immune system. It's there to do a job for you, and it's supposed to keep you healthy. Probably a little more than even these masks do. So just to give you some insight on what masks can do and what they can't do, but use caution. Make sure you do all the things you can do to increase your own safety and the effectiveness of your immune system. Remember, get adjusted and stay informed.